But look, as sports start opening back up and restarting with the bubble scenario, you've got with MLB and the way they're going to be doing it. MLS, as we talked to Matt Jordan, there's a lot of different things that are at play here in terms of logistics, the testing, everything that's going to happen. And joining us now is Dr. Larry Caplin of Docs HealthWorks. He is an expert in logistical healthcare. Dr. Caplin, how you doing?
I'm doing well. How are you two doing?
I'm doing all right. Must be a busy time for you right now.
Being CEO of a logistics healthcare company in the middle of a pandemic has us a little busy, yeah.
So thank you so much for taking some time out. Now, let's jump right into it because we are talking about sports and how everything is reopening. You've worked with stadiums before, and this is, it's uncharted territory for a lot of people. What are some of the challenges that they'll run into here as they restart during a pandemic?
Well, there's going to be a lot of them. One, we're going to have to deal with what we're doing with the personnel themselves, the athletes, the staff, the support people, everyone who's going to be around them. And then when do we make it safe for people to come back in and be spectators? Or are we all just going to watch sports on television from now on? How are we dealing with youth sports? There are a bunch of challenges floating around about how we're doing it. And of course, things are changing dramatically right in your home city.
Help me understand, Doctor, too, how these things are. So I feel like things have changed often every day. And not that the scientists and the doctors have been confused, but I think we're getting more information about the virus. So help me understand why we believe that kids are not as vulnerable, and there's still youth sports going on. There's some social distancing, but there's still some stuff going on.
So what we found is that by and large, kids are less, they have less bad outcomes associated with the disease. But what we're also finding, like right now in Houston, I mean, you're at what, roughly 50% of the people that are hospitalized are in their mid-30s. That's the average age right now. So where 3 months ago, we were seeing a lot of people that were being hospitalized at 65, 75, 85 years old. And we had less than 40% of the population that was sub 60. That whole age group's dropped down, and we're seeing a lot more people. So one of the things that we're recognizing is there's an inflammation that's associated with this, and it seems to be tied to the blood vessels. So you have blood vessels in everything. And because you have blood vessels in everything, you're getting inflammation in the brain, in the heart, in the organs, all over the place. And we've had some children die. We're having people that are younger that are having complications. And we really don't know what the long-term impact is going to be on a 25-year-old who ends up being in the hospital for 2 weeks or ends up on a respirator for a week. There's going to be lung damage. There's going to be other damage that we're going to deal with 20 years from now, 30 years from now.
So with that being said, and with how much information changes, the NBA with the bubble format, MLB, everyone again, MLS, they put together this plan, let's say 3 weeks ago or a month ago, right? And the information back then is probably not the same as it is now, as you mentioned. Is it wise for these leagues to return and restart sports?
Well, if you asked me that 3 weeks ago, I may have given you a little bit different answer than right now, right? We've lost the trust of the population, of the general public. We had their trust early on. They social distanced. They stayed home. They did what we asked them to do. You get about 90 days where people are going to tolerate that. The problem was we asked the entire country to do it simultaneously instead of really focusing on the areas that were hotspots at the time and letting the rest of the country continue to live their lives. And you would have had a slow build across the country, but we shut everything down. So now in Texas, right, we just literally today changed all the rules. Bars are going to be closed again. Restaurants are back to 50%. Things are going to change. We have 10 times the number of cases today or yesterday identified than we did on June 1st, 3 weeks ago. And the deaths that we're going to see associated with the cases today, we're going to see 3 weeks from now. That's when we're going to start to see the deaths from today's cases that we're identifying. So, the NBA built a 6-phase plan to implement. Their general philosophy is this. It breaks down into 2 pieces, right? They're trying to create an island. And they want to make sure that they test everybody and that nobody gets on the island who's positive. So today we identified 16 NBA players that were positive. So they're not getting on the island. We're going to have to test everybody, keep them all isolated, or keep them all quarantined. Then once they get onto the island, Orlando, then we're going to go ahead and try and keep that island isolated from the rest of the country. And that's going to be a problem, right? Because you have roughly 2,000 people that are going to end up supporting that entire population. So, that's sort of the plan as it is now. If they can get compliance, it'll work. If they can't get compliance, it's not going to work.
Dr. Caplin, do you see the NBA working, the MLS working, and a little bit further down the line, the NFL working? Because there's so many different variables, and there's a lot of contact in these sports.
Yeah, well, Major League Baseball has added a twist of they want to travel. So that, and the NBA has a shot at doing this, right? Because they picked a really smart location at Disney where they can basically, it can be isolated from the surrounding community. They literally, it was built that way. So there's an opportunity to manage that you wouldn't probably have in Major League Baseball. NFL is going to have a challenge too. Once they decide that they're going to travel, then it's, yes, okay, we're going to fly in chartered planes. Fantastic. That's easy to manage. But how do you deal with security personnel, staff at each city, the food service people that you're going to be interacting with? It's just, the list goes on and on. Fans, right? And then how are you going to keep all the players and personnel from interacting with any of these other people that may or may not be contagious? So we have an increasing rate of contagion right now through this country that's pretty dramatic. We were hoping for a slowdown in the summer, and we're not getting it. It's actually the opposite. So, and then we're going to have a whole series of issues when the weather changes and we go into actual flu season. So we're not in great position right now.
If fans are allowed at a 25% clip or something even lower, what kind of protocols do you envision these stadiums would have for the NFL or MLB?
All right, so we're talking to a lot of them about this, and every single person who attends needs to do a pre-screening. So we've established a protocol where they go onto an app and they do a health history screening and a contact tracing, not contact tracing, but contact exposure screening. They would be issued a code, comes to their phone. When they show up at the stadium, they would need to scan that code to confirm that they were in fact cleared, and they'd have to accurately take their temperature at the time. So now we have a historical data set around whether somebody has symptoms of any kind or whether they've been exposed at all, and we're taking their temperature at the same time. One of the advantages we have at most sporting events is everybody's facing the same direction. So we don't have the same issue we have with restaurants where people are facing each other. But everybody in those stadiums needs to wear a mask. And I don't mean a bandana. I mean a real medical grade mask. A bandana trying to stop a virus is like using a chain link fence trying to stop a mosquito. It's just not going to do it. So we really we're going to need to have those protocols put into place. And if everybody thinks that they don't have to follow them, you're going to get what we're getting in Texas and Florida and Arizona. And you name it, right? We have 20 states right now that are all climbing. And really, if you look at the data, there's about 36 states that are increasing right now. There's about 25 of them that have crossed the threshold of more people getting infected than actually have it.
Dr. Caplin, are they I feel like I'm also a soccer fan, and I'm seeing Serie A work. I'm seeing La Liga work, at least initially, and the EPL. Are they doing something different there in Europe, or are they just safe? Why is it able to work so far there?
Compliance. Their national compliance has been different than ours. We have a bigger country. We have a lot more people. Really what happened was they had a country exposed. We had New York and the surrounding communities, Washington State and the surrounding, or Seattle and the surrounding communities, parts of California and the surrounding communities. By and large, that's where we got exposure. We locked everybody down. So what we did was we kept everything isolated into those regions, and the rest of the country never got exposed. they're now getting exposed. 90 days later, we opened up, and now everyone's interacting with each other, and everybody's fed up with being locked up. And this is what you're seeing. So Texas is going through its first wave, not a resurgence. And all of these areas are the areas that weren't exposed previously. So they handled it differently than we did. And we're not getting the compliance that we need. And we're going to have a problem as a result of it. I mean, that's really our underlying issue.
Dr. Caplin, let me follow up, because that lady that I read, let me see if I can find it, about the death rates are really low, and it's a glorified cold, I think is what she called it, 98% success rate of surviving this. Just can you talk the science and the numbers behind what some people are saying? Because I feel like it depends who you watch, what you believe.
So let me start off with something less scientific and more sort of directly to the point. Within 4 days, I lost both my father and my father-in-law to COVID-19.
So okay? Sorry.
So, and my father, he was ill. My father had Alzheimer's. He was ill, and he was actually a ball player. He was drafted by the Twins. My father-in-law was vibrant, healthy, communicative, interactive, was fine, and went into hospital on Thursday and was gone by Tuesday. This is not the flu. We have a death rate that's about 5 times what the death rate would normally be from the flu. The flu, you normally get what's called a U-shaped curve. So you have the really young and the really old, and everybody in between is pretty safe. And that's what you end up with. This is not that. I've known 55-year-olds that have passed away that were young and healthy. It has to do, what we're going to see, it's going to be interesting, because you're going to see obesity is going to be tied to this in a significant way. It hasn't really come out yet, but you're going to see that people that have issues with inflammation are going to be particularly susceptible. So we have people across the spectrum that are being dramatically impacted by this. I mean, look, the regular flu, you don't have a 40-year-old in the hospital and on a ventilator for 20 days from the flu. So this is not just the flu. And look, we're already at 120 plus thousand deaths in this country. People can argue what proportion of them are COVID, what are not. I can tell you my father-in-law was listed as COVID. My father was not. So everyone's not being listed as COVID positive deaths. And it's not an economic issue that's driving this, so the disease, the problems that we're having with this are more profound than you would normally experience. And people need to realize that, and look, my job is to get everybody back to work. My job is to get everything back open. And we can do that. We can open this country back up again, have everybody go back to church, watching ball games, doing the things that we want to do, living our lives. But they have to actually abide by what we need to do. And if they don't do that, we're going to get what we're seeing in Texas and Florida and in other parts of the country.
Dr. Caplin, is it still as simple as social distancing, wear your mask, wash your hands frequently to help stop this now, and hopefully we don't have this second wave in a month or 2 months?
So let me talk to you a little bit about social distancing, right? There's nothing magical about 6 feet. 6 feet's based on a study that was done in 1939. Okay, that's where that came from. What we really have is it's creating a barrier. So we said, okay, if I create a 6 foot barrier away from you, David, then the likelihood of us having this conversation of droplets getting to you is dramatically reduced. So the likelihood of you catching it that way from me is reduced. If you and I were standing on either side of a glass door, we could be 2 inches apart from each other. And I wouldn't be exposing you, or you wouldn't be exposing me. So it's about a barrier. When you add a mask to the case, and that's why I said a real mask. If you put a regular 3-ply mask on, you get one level of protection. You put a KN95, you get another level of protection. You put an N95, you get another level of protection. So every time I increase that level of protection, you and I can be closer to each other as long as we're both wearing masks. So we can get into a dynamic where we're living normal social distancing to each other if we're masked. But if we're not, then we need to be much further apart from each other. And people are just, they're not washing their hands like they were, and they're not doing the things because they've candidly gotten desensitized to it. It's been a long time, and they looked around, and in Houston and Austin, they looked at people. Outside of Philadelphia. I'm halfway between Philly and New York, and they looked at us and said, "You guys are crazy up there, right? There, you have that going on. I don't even know anybody who got this thing." And they were locked in their houses. Now they're out and they're living it, and the whole world's changing. But they need to do this at schools, churches, bars and restaurants, museums, ball games, stadiums. They need to do it at all these places.
Dr. Caplin, let me ask you this final thing from my side. Do you see another shutdown coming like it was a couple months back?
I don't think the country will tolerate it. I don't think economically we could survive it. I think there's too many small businesses that are just getting the tar kicked out of them. And so I don't think so. But, one of the things we're not doing well is figuring out where people are getting it, because they're not getting it everywhere, right? If you're watching your kids play baseball and all the fans are spread out along the behind the fence along the sidelines, and they're not all standing next to each other, or they're watching from their cars, and the kids are pre-screened and temperature checked ahead of time, there's no reason those kids can't play baseball. But do you want to treat soccer exactly the same way? Ice hockey, football, basketball, they're a little bit different, right? There's no reason in the world people can't be racing cars and fishing and hunting and doing other things that are more independent. We need to be targeted, and we're not tracking where people are catching it. So we're just taking a shot in the air and saying, well, you know what, it's the bars, or it's the churches, or it's the whatever. And we're not actually figuring out where it is. And that's really what we need to do. We get onto that, and then we can sit down and say, okay, wait, this is how we adjust what's going on in the bar, or this is how we adjust what we're doing at a stadium. And we need to do that in order for us to move forward. That's really what has to happen.
That's a great point. Yeah, that the tracing is going to be so important here for the second step and figuring out everything else. Dr. Caplin, thank you so much for taking some time out, man. It was nice talking to you, and it's going to be interesting to watch the next week, 2 weeks, month, because everything is changing so much. We appreciate the time.
Hey, every day it's a little bit different. It's a lot different in Texas today than it was 2 weeks ago. Yep. And I just, guys, strap in, because you're going to have a tough couple 3 weeks.
I appreciate you, Dr. Caplin. Thank you so much, sir.
All right, be safe down there, guys. And I appreciate your show.
Thank you very, very, very much.